Dr. Stephanie Christian. Welcome back to Tuesdays with Timeless. Several months ago, I did a video with all the details about rosacea. But this month, I've been talking about the treatment of a number of vascular conditions. So I wanted to close out this month with a discussion of the laser treatment for rosacea. But I wanted to start with just a summary of rosacea. Rosacea is a chronic but treatable inflammatory condition that affects the central part of the skin on the face. It affects 16 million people in the United States, people of all skin types. But the people who are most susceptible are fair-skinned people. The vascular rosacea can present in a number of ways. There's a diffuse pink, and then it advances to red background, which is permanent, and there are vessels overlying that. At first, they may be just sort of spiderwebby, very fine pink vessels that then get bigger and become red, and then those vessels become very discrete, individually apparent vessels that will be red, and then purple, and then blue. It's important to remember that treating rosacea like this, the vascular type of rosacea with laser, is not the primary treatment for rosacea. There has to be a holistic approach. It's an inflammatory condition, and it has triggers that are lifestyle triggers. So the first thing to do is to make sure that you have a diagnosis. The second thing is to make sure that you've identified all of your triggers. Almost everyone that has rosacea has sun as a trigger. Almost everyone that has rosacea has stress as a trigger. But then there are other triggers, and people vary in which of these triggers they actually have. Heat in very many manifestations is a trigger. Certain foods are triggers. Alcohol is a trigger for a lot of people. Certain medications, certain supplements, certain products can be triggers. Anything that makes your skin burn or tingle or sting are things that you should stay away from. So identifying your triggers and then mitigating your exposure to those triggers is a really important part of managing this chronic condition. So once I have a patient in my practice, and for some reason I have an enormous rosacea practice, I tell everyone to use a zinc-based sunscreen every single day for the rest of their lives. I tell them to do some kind of stress management. It doesn't have to be hokey, it doesn't have to be expensive, and often the best thing to do is to do some kind of breathing exercise. But you can't suddenly decide you're going to do a breathing exercise in the heat of stress. This is something that you have to practice when you're stress-free. So when you're taking a walk or when you're listening to music, that's a good time to practice a breathing exercise. Then eating an anti-inflammatory diet. And then using products that are not only not bad for you, but are actually beneficial to your skin. And then staying away from things that are actually detrimental. There are certain prescriptions that are very good for pustular rosacea that can actually trigger vascular rosacea. And for some reason, they get prescribed a lot. So now on to the meat of this discussion, which is the laser treatment of vascular rosacea. I have two vascular lasers, but one of them, the XLV, is my absolute favorite for treating rosacea. It has two wavelengths. The 532 is great for that diffuse pink or that diffuse redness in the background. It's also great for the little tiny spider veins, that are little tiny web-like vessels that are there. But then I have both wavelengths, the 532 and the 1064, with which I can treat any color of face veins that happen to be the challenge. How do lasers work? Well, lasers put out pulses of light energy, and I choose the wavelength to target what I'm trying to treat. And when that light energy hits the target, and in this case it's hemoglobin, the hemoglobin converts the light energy to heat, and heat is the tool. The heat then destroys the vessel, which is an abnormal vessel, and it shuts it down, and then the body reabsorbs it. So it's really a pretty straightforward process. What does it feel like? The foot pad of this laser is cooled down to 5 degrees Celsius, so you feel cold, and then you feel little pulses of heat. But overall, most people say that this is not at all a miserable treatment. However, to the skin, there is a lot of destruction of vessels. So afterwards, there is swelling, and there's initially some increased redness. So for people that are not working from home, for people that are going out in the world and working, I recommend having this procedure done on a Friday so that you're ready to go back to work on Monday. And we have things that we do to decrease that redness and swelling. The number of treatments really depends on how bad the rosacea is. And I can't predict without seeing you. It's just that it really depends on how bad the background redness is, how many vessels there are, and how many layers of vessels there are. So that's what we have for treating rosacea. It's very effective, and I hope this helps. And if you have any questions or comments, please mark them below, and I always answer. I hope you have a great week, and that this is a calm and thoughtful week. Talk to you again soon.